Hey, everybody. This is Joshua Littrell with the Veterans for Cannabis podcast. Thanks for joining us today. Today, we've got a great guest. She's a physician and she's doing some really great work, a veteran herself. I'll introduce Dr. Kano in just a moment. But I want to just give you a little heads up on where we're going with today's conversation. We'll get a little bit about her background. We'll talk about some military service. We'll talk about her occupational specialty, what she specializes in as a physician. And then we'll talk about really the area of focus and study for Dr. Kano moving forward. Dr. Kano, thanks for joining us today.
Thanks for having me.
Absolutely. It's such a pleasure. If you wouldn't mind, give our listeners a little heads up on where you're at in this country right now.
I am coming to you from Colorado Springs, where it is about 80 degrees right now, and in 2 days it will be snowing and about 30 degrees.
Oh, wow. That
Yeah.
is phenomenal. That's one of the things I love about Colorado is the fact that you can play golf and go fishing and go snowboarding in the same day.
It's true. It's very true. Yes.
Absolutely. So tell us a little bit about you, where you're from, and then we'll get into your military service if you don't mind.
Okay. Well, I'm actually from Colorado, born and raised in the mountains in Colorado, up by Breckenridge. I moved to Colorado Springs probably when I was 18 and joined the Navy out of Colorado Springs, actually, when I was, I think, 21. And so I did that, and then I decided I would come back to Colorado to go to school and get my doctorate degree and then practice.
Wow. So you're a Colorado girl, born and bred, and one of those true ones that can say, I am a Coloradan,
Yeah, so I have my fuzzy vest on for warmth right now and my flip-flops at the same time.
Oh my goodness, that's so funny. So funny. So tell me a little bit about the Springs and how you like it. The Air Force Academy is there, and I'm an Air Force guy myself, so I love that area. I think it's beautiful. And we'll pause just a moment as we say the Air Force Falcon passed away this past weekend. I think he was 23 or 28 years old, so he lived a great life and served his country well. I want to say thank you so much, Air Force Falcon. Tell us a little bit about the Springs.
Well, so the Air Force Academy is here. Schriever, the base, is here. We've got Fort Carson Army Base, Peterson Air Force Base as well. We have the Chemical Depot in Pueblo, which is about 40 minutes south of here. So we're pretty surrounded. Buckley Airfield is up in Denver. So we are right in the middle of military and veteran territory.
Man, I'll tell you, that's pretty amazing. In your day-to-day operations outside your practice, do you come in contact with a lot of veterans in the community, or are they really supportive of the veteran community there?
Yes, we're pretty supportive here. You can't go anywhere here in town without meeting a veteran. We have a lot of retired military here, especially. And so I would say of all of the locations in the world, we are probably one of the most vet supportive here.
I think that's absolutely on point. And I think, when you think about the retirees, Colorado and Florida typically are right there on the tops of military retirees on where they want to go to. So it's pretty amazing.
Well, I think we have a lot of good comprehensive services here. The weather is amazing. There's a ton to do outdoors here. And so it just calls to people.
Phenomenal. Absolutely love it. So your Navy, tell us a little bit about your Navy service and what you did while you were in.
So I was an avionics electrician for F-14 fighter jets out of NAS Oceana in Virginia Beach. So our squadron trained pilots to learn how to fly and get on and off the carriers.
Wow, I can't even imagine. Now, did you serve on a carrier at all?
I did not serve on a carrier. Our squadron did mini deployments, if you will. So we would go out for a couple weeks and then come back. So we did not do full tours.
Beautiful. How long did you serve?
3 years, and I was medically retired for injuries.
Okay, awesome. Well, I can't say thank you enough for your service, and your country says thank you, and all the listeners too. We have a really big veteran following, but then the civilians that listen too, it's good for them to hear from the side that served and those men and women that are willing to pay the ultimate price if we had to and called upon, so thank you again.
Sure, absolutely.
So you're a doctor. Tell us a little bit about that. Now, you go from working on jet fighters to working on people. I mean, how does that happen?
I know, it's a crazy journey. Well, part of it is when I was retired out was just after 9/11. And so there was not work to be found in the air wing anyways. People were not flying, they were afraid to fly, and so there really weren't jobs in that field.
Right.
And I didn't love it, to be honest with you. So I knew when I went back to school it would be for something else, and I actually went for criminology, and then realized in that program that that was not exactly the right fit for me. And so I went ahead and got my master's in clinical psychology, and then realized if I want to do a lot more with this field, I need to get my doctorate. So I got my doctorate in neuropsychology, and I also have a postdoctorate degree in psychopharmacology.
Wow, psychopharmacology. And I'm actually really excited to talk to you about that. But before we get into that, I want to talk about, when your brothers and sisters come to you in your practice, when you're dealing with PTS and things that happen in our veteran community that are at a higher level and impact more personnel, if you will, than normal civilians do, how do you deal with that? And do you see that veterans, when they come see you, are they more open because you are a veteran yourself?
Yes, absolutely. And we have other practitioners in my practice that are also veterans. And so, as you know, I should say, there's a camaraderie there, and there's an immediate sense of calm being with somebody that you have served alongside. And so that helps take some of the psychological defenses off the table initially. And so I feel as though we can get down to the good work more quickly that way.
Absolutely. And I think exactly what you said is exactly how it is in our community because, we want to talk to our brothers and sisters who have been through it. And if you haven't served in combat, at least you've been through the training. So you know how to talk to us. You know how to communicate with us. You know the lingo. That's it. It means a lot and it goes a long way in our community. So thank you.
Well, the military lifestyle in and of itself is a whole different level of stress than civilian lifestyle. And then if you add combat on top of that, it's a whole different ball game. But even people who've just been in the military as a whole are living a completely different life than most of the people. So just being able to, at minimum, relate on that level, you're right, it's very helpful.
Makes a huge difference and a huge impact. So, do you utilize the VA at all in your own personal care? And that's, you can answer it either here nor there. It's not, but I was just curious about it.
I would say that I have a scattered history with the VA personally.
Okay, and I think that's a lot of us have that same history.
As a female vet, and keep in mind I got out 17, almost 18 years ago now, I did not feel that the VA, I had some very good experiences with a particular doctor up front, but the environment as a female was very overwhelming to me and male dominated. And so I chose to go outside of the VA for a lot of years for care. I have recently re-engaged with the VA because they have shifted a lot of their programs and they're trying to be much more inclusive. And so when I say scattered, that was because of me, not because of them per se.
Sure, sure.
But the VA is trying to do a lot more for our veterans now.
Yeah, they are. And let's expand on that a little bit because we have a lot of female listeners that have, I'm sure, gone through exactly what you have gone through because, it was a male-dominated industry. And it was ridiculous that when I first joined, which was 99, women weren't really taken care of through the VA. And now they're finally improving that process. We're really talking about female care. We're talking about, all the things that you guys deal with that's different than a male, and the camaraderie is different, the communication is different. So, what are some of those programs that have improved over the last 15 to 20 years?
Well, I think awareness for one thing. When I started using the VA, I can remember I was the only female in that clinic. The minute I
Wow.
walked in, I was the only one. Now, when I walk in, there's maybe 3 or 4 others. But I can remember several years into getting back here, receiving a survey from the VA asking specifically why was I not utilizing them more. And so I think they started to gain awareness about the fact that we're missing a segment of the population by not getting the females in here. But they didn't truly understand why either. I think they just assumed, well, you have this benefit, why aren't you using it, without looking at the other factors. And I think they've done a decent job of trying to open awareness, gain insight, and make some changes based off that information.
Wow, that's so great to hear. And it's really good that we're finally getting that change that has to come from the top down. And I think you're seeing it now. It's because the female leadership has increased. We finally got generals that are females. We finally got, the company commanders that are females. This is exactly the way it should have been for, entire service, in my opinion.
Yeah.
But I'm super glad that those changes are coming in place now. what are some of the improvements that you've seen very specifically when we talk about female care, like obstetrics? Am I saying that right?
You are. I
So
don't receive
OB
that
clinic,
type
right?
of care there myself. However, when I started using the VA, that wasn't even an option actually.
Right.
When I was going to that clinic, not only was I the only female patient, but there was only one female provider in the entire unit. And
Wow.
so now when you go in, there are many more female providers of various sorts, and they have specialty clinics that embed women's health, which never occurred in the past at all. So I think they're starting to carve out that sector and then bring it in-house, where before you were always sent out in town to somebody else.
Yeah, and that's so frustrating because when you get, oh, let's call somebody else, or go over here and get seen. I mean, what in the world? How do you feel when you go in and you think your country's going to take care of you and then they push you out the door to go see somebody else, right?
Well, not only that, but I think what's hard is, as you know, and many people who are listening will know, by the time you get the gumption up to actually go in for treatment of any kind, um, you need no deterrence, right? Like, I've finally gotten the gumption, I'm going in, I need help in any capacity, and then to be off put in any way deters progress. And then some of those people will not re-engage again. So not only is it being farmed out, if you will, but it's a direct line of care. We need to make that as easy as possible so that people will utilize the services.
Yeah, I couldn't agree more. My wife has been in 20 years now, and through her, she's going to end up staying 22, but she had started the process of going through TAPS, and getting set up in the VA system and all that stuff is something that they tell women now, which is a complete different. That's a
Oh yeah,
180
never gonna
change from what it was 20
like
years ago.
that. Yeah, nothing like that.
Yeah, I love it. I'm so thankful that women are finally being taken care of through the Veterans Administration the way that they should be because they serve just like we do, men. They serve right beside us, alongside combat, in every capacity. So why in the world wouldn't we take care of them from the VA's standpoint? So
Well, and
very
I
thankful,
think that has changed as well, because when I was in, women did not go to combat. Women were
right?
not allowed on nuclear subs, and some of the carriers as well. And so, in general, women are more involved in all forms of the military than they ever have been in the past. So they absolutely have to be represented so in the VA as well.
Absolutely. They improve our service too. They
Well, we
absolutely
all
do.
improve each other's service. That's the
Hmm.
thing. Yeah.
Absolutely. So let's talk about your specialty and what your practice does right now. And do you have any impact or direct interaction with the Veterans Administration on kind of what you do on a day-to-day basis?
So we do our practice. We have a lot of different treatment programs here. We offer a lot of different types of treatment. One of the things about our practice that is stellar, in my opinion, we do really thorough psychological and neuropsychological evaluations so that we are very clear about what we're treating. And for instance, are we just treating PTSD, or do we have a comorbid TBI, or is it actually TBI and not PTSD? A lot of these things aren't ferreted out, and so people are not getting proper treatment. So coming in the door, we're very clear about proper diagnosis, and then we offer a multitude of different treatments. And
Now,
so,
that
oh,
triage process, sorry, that triage process, when they're coming into you, how do you determine the comorbidity that may be there? Is it through a questionnaire or is it a questionnaire that's guided with a nurse? What's that process like?
so our questionnaire is extremely thorough. Some would say too thorough. It's about a 40-page document of full of information that I'm gathering about a client from birth forward, actually, because what we know now is that a lot of people go in the military that already have trauma from childhood.
Right.
And so we're looking at from childhood on, what have you experienced? And is it just in childhood? Is it childhood and then military experience and then combat experience and then TBI? And so I'm looking through all history. And relatively well, I can determine what's what. But if I'm ever not sure, then I will ask the client to go through a full neuropsych evaluation.
That is beautiful. And, I think it's something to really mention right now that even from the Veterans Administration, that change has happened too, which is really nice because when I first started being seen for my PTS, they went all the way back to just exactly what you were talking about. And they did, I lost my mom in a car accident in 91. I was 10 years old. And that was a huge tragic event, right? So they actually tied a lot of what some of my issues were tied to that. And I don't disagree with that at all. But then we get to the combat portion and they tie it into that as well. So, I think understanding that helps you better serve us, the patient, right?
Well, because we see